treatment. And a review recently published by the American Heart Association is reaffirming that the warning signs can vary greatly for women compared to men. Knowing the difference can save your life. Here now to discuss is Dr. Heather Swales, cardiologist with Hartford Healthcare's Heart and Vascular Institute. Doctor, welcome. Thanks for being with us.
Thank you for having me.
So based on the patients that you see, are women aware that heart disease is their biggest health threat?
Unfortunately, just about half of women know that heart disease is the #1 health threat that they have. I think most women know a lot about breast cancer and the importance of screening mammograms, but women generally don't recognize that heart disease affects 1 in 5 women in their lifetime, compared with breast cancer only affecting 1 in 8 women in their lifetime, and the importance of prevention and heart disease.
Interesting. All right, if someone has a family history of heart disease, what should they be doing about that?
So if you have a family history of heart disease, your risk of having heart disease is higher than the general population, and so controlling modifiable risk factors like blood sugar or blood cholesterol is particularly important, and it's especially important to discuss your risk with your healthcare provider to see what other things you need to be doing to reduce your risk as much as possible.
And Doctor, heart disease can often lead to a heart attack. What are some of the symptoms that may present specific to women? It's not just the elephant on the chest, right?
Exactly. So men and women do usually both have some type of chest discomfort. Women tend to describe it slightly differently than men, and they're more likely to have other symptoms such as pain into their shoulder, their back, maybe into their jaw. They also often have other symptoms such as sweating, extreme fatigue, trouble with their breathing, and their symptoms, interestingly, tend to be more mild and subtler, so it can make it more difficult for us as healthcare professionals and even as patients to recognize that there might be something going on with the heart.
All right, this is one of those topics a lot of women want to know more about, and there is an event coming up for people to take part. Tell us about that, Doctor.
Yeah, so it's a really fun and exciting event called Pinot and Prevention. It's going to be on September 15th at the AquaTurf in Southington. Tickets are $30 and you can register online. We're going to have food and beverages. We're going to do some talk on providing information about heart disease for women, and we're also going to have a terrific comedian. So I would encourage women to come, bring their sisters, their friends, their mothers, their daughters, and learn more about heart disease, because as we get more information out there, we can do more to prevent the #1 killer of women.
What a great, fun event. That sounds great. All right, and we'll have more on that event on WTNH.com and the News 8 app if people are interested. Dr. Heather Swales, cardiologist with Hartford Healthcare's Heart and Vascular Institute, thanks for joining us.